in progress.
Good day, everyone. My topic for presentation today is components of a research paper. I am Dr. Saseendar, Professor of Orthopedics from Lakshminarayana Medical College, Pondicherry. I serve on the editorial role of these journals. I do not have any other conflicts of interest. Okay, coming to the topic. The often described method of writing an article is the IMRAD format that includes introduction, methods, results, and discussion. However, there are other components that need to be understood that includes title page with author details, abstracts and keywords, conclusion, acknowledgements, and references. The title page should be something like this. It includes the title, the list of authors in the order of appearance, and the affiliation of the authors. The authors have to be given as per the amount of work performed by them. The title should be an eye catcher of the study, should be specific, should be searchable. There should not be any abbreviations in the title, and a running title may be needed as per journal requirements. The title can be descriptive or interrogative with a catchy line. These are some good titles. The unsolved fractured neck of femur, an unusual case of gluteal pain. The anatomical location of pain in hip osteoarthritis, anterior knee pain and osteoarthritis in postoperative cases of reconstruction of the anterior cruciate ligament. These are some good examples of titles of a research paper. In the introduction, briefly introduce the reader to the problem, existing evidence, and the aims of the study. It should be in a funnel-shaped approach. That means mention the problem in a generalized statement and then narrow it down to the hypothesis or the research question. It should stimulate the reader's interest. In the introduction, avoid long introductions, too many references, extensive critique of others' work, and unclear objectives. The methodology should explain and justify the method of data collection and analysis. A methodology is needed to allow others to evaluate what you did, to see if the conclusions are valid, to decide whether the findings are applicable to other situations, and to also allow them to replicate what you did in order to test it and to do further extended research. The methodology should be an overview of the study design. It should include details of equipment, organisms, reagents, etc. used, the population that was studied, whether approval of human or animal research ethics committee was obtained, and the type of statistical methods used. The methodology should be written in past tense. For example, patients were selected, exclusion criteria included, the research study focused. It can include subheads for better understanding, may include figures, for example, flowcharts, diagrams, and tables. Coming on to the results, the result is the core of the paper, often includes tables, figures, should summarize findings rather than actually provide the data. Present results but not comment on them. Allow the readers to take the implication of the results. The results should also be presented in past tense. Example, 55 patients were treated, 38 were males, the time of treatment was, so on. These are some few checklists for the results. Make sure the results are in logical sequence of data presentation, are accurate in data, there's no repetition of data, and there's no overuse and abuse of tables and figures. There are a few points we need to remember with respect to the tables and figures. Use them only if they will help to convey the information. Avoid extensive overlap between the text and the tables. Write appropriate legends for each table and figure. Avoid too much information in one figure. Also, the text should emphasize the findings and not the table or figure. For example, in this statement, researchers who attended the workshop published twice as many papers per year. And in bracket, you mentioned table. Don't say table 3 shows the researchers who attended the workshop published twice as many papers per year. Moving on to the discussion, where the most important and difficult part to write, use short paragraphs. Do not repeat all results of the study. Should not be too long and not more than 50% of the whole article. It should address the hypothesis stated in the introduction, should begin with a brief summary of the main findings, and should move from specific to general, reverse funnel approach. The discussion should compare with other research and see whether the current findings are similar to other publications or better or worse than previous studies, and mention why. The discussion should also talk about the applications and implications of the results. For example, there can be applications in healthcare, public policy, or even in the industry. The discussion should also include an important paragraph with the strengths of the study and the limitations of the study. These are some common mistakes in the results. Too much repetition of data, incorrect interpretation of the results, inadequate interpretation of the results, and failure to identify the weakness of the study. Omission of key references, preferential quoting of references, and too long or verbose results are also not allowed. And finally, we have the summary or conclusions. This is a separate section or the last paragraph of the discussion. Only the most relevant findings of the study should be presented here. It should act as a take-home message and should not be a repetition of the abstract. And finally, you also provide the references, which is the list of sources of information used for the study. The references are needed to avoid plagiarism, show the depth of the research, to acknowledge direct quotes, to provide evidence to support arguments, and to allow the reader to verify the data. References can be provided in the Harvard style or Vancouver style. In the Harvard style, the references are provided in text in bracket with the first and second author's name and the year of publication. And in the list at the last, it is mentioned in the alphabetic order. Whereas in the Vancouver style, the references are numbered in the order of their appearance in the text, and the list is provided in the same order. You can add it up with an optional acknowledgements where you thank people who have helped with the work but did not make contributions deserving authorship. But permission should be obtained from these people, and sometimes you can also disclose your financial support in acknowledgements. All these have to be prefixed by an abstract, which provides an overview of the article. This should be the best paper of the article, and it's also most frequently read part of an article after the title. An abstract should be complete and self-sufficient. No references, tables, or figures should be provided. There should be no or few defined abbreviations. There are two types of abstracts. In the structured abstract, you divide the abstract into subtitles, including background or purpose, methods, results, conclusion, and keywords. In the unstructured abstract, the text is the same but is not divided into subtitles. And then comes the covering letter. Add a covering letter that is very convincing to the editor, and that's it. Your article is ready for submission. Thank you. These are my references. Thank you.